why we come to Cullen Middle School. But we come because Mr. Williams is here. Mr. Williams is 88 years old. Let me have my good friend and the media strike and start again. You know, I know you're on video, but can I get you just to, I'm going to start again? Oh, it's live. Okay. 1, 2, 3, we're starting up again. I have the same message, but we're starting up again. Strike that you just had. Somebody is laughing in the newsroom, I'm sure. They're laughing. That's okay. I don't have a problem with that. Good afternoon. I'm Congresswoman Sheila Jackson Lee. This is why we come to Cullen Middle School, a historic middle school, but in the neighborhood. And the reason is because 88-year-old Mr. Walker is here, and he just got his first vaccination shot. Mr. Walker has 4 children. He worked as a porter. He helped build America because he's worked in the automotive business. He deserved to have a vaccination site so that he could be part of making sure we can open up this country. Mr. Walker, I want to thank you for coming. We want to applaud you. We are happy to see you.
Right.
Are you happy to be here?
Right.
You're happy to be here, sir?
Yeah.
All right. Thank you to Mr. Walker. And guess what? We said that we want to vaccinate children, young people, so they can do summer school. They can be out during the summer. They can be in school in September. We can open it up. This is Carrie Ann Chambers, and she's getting her vaccination. That's what this is about. We're excited, and every time we see Mr. Walker or Carrie Ann, we want to applaud. So let Karen, we're putting you on the spot because you're old enough to be on the spot. Why are you here? You know why you're here?
Yes, I just turned 16, so I'm getting my COVID shot so I can be free from COVID, and I won't have to bring back to my family when I go out and want to enjoy myself.
Yes. All right. All right. We're excited about that, and she is right, because the census is telling us that the population of those being hospitalized right now are under 40. They're children, they're teenagers, and they're in their 20s and 30s. That's who's being hospitalized because they're not vaccinated. And it is determined that COVID-19 for this age, you get pretty sick. So I'm excited about continuing to open vaccination sites in the neighborhood. Thank you to Cullen Middle School and HISD.
Thank you, Congressman.
So let me first of all indicate that we will not open this country unless we break through the vaccine hesitancy. We've got about 130 million Americans vaccinated. It's not enough. That number has been stable now for 2 to 3 weeks, maybe even a month. We cannot open the country. We cannot completely rid ourselves of masks if we do not get a certain amount vaccinated. That's what we're discussing in Washington. That is what's going to happen. No matter what science the Centers for Disease Control continues to emphasize, and they are right to emphasize the science, no matter what policies they put out of saying that if you're vaccinated and you're another place with people vaccinated, that you can take off your mask, or you're vaccinated and you can be outdoors, people are going to be hesitant. They're going to wear their masks, and things are going to be up and down. Some people will be in a stadium because they're in a stadium, and they'll be without masks. And within that stadium, there'll be someone that is COVID-19 positive. Or there'll be someone COVID-19 positive in a store. Because in addition to not being vaccinated, we're also not being tested. And so I clearly want to make sure that you're being tested. Mr. Walker is okay. Mr. Walker, you're okay? Are you ready? You're okay?
Yeah, I'm okay.
I want you to stay. I want them to see Mr. Walker. Mr. Walker will let his congresswoman know when he's ready to go. But this is what helped build this country, and this is who's building this country.
All right.
But today, I have a pretty strict message. We are not comfortable where we are. We should not. We cannot open America if we do not get vaccinated. And one of the reasons is that Dallas, Texas, for example, Dallas reports new variant. 1 out of 3 Texans are vaccinated. That's not enough. And they have found 2 cases in Dallas of the India mutant. We already know the tragedy that's happening in India, the desperate need for vaccines, the loss of life. We will not in America open up if we cannot get vaccinated. So that is why today we are here again, May 22nd, 1 week out before the Memorial Day weekend. We're now 33.1 million cases in the United States, 588,000 deaths. Yes, we're doing better, but we're creeping towards 600,000 deaths. It'd be good if I could say we're stopped. It's 588,000, Madam Principal, and there are no more. But I can't say that. Harris County, 398,000 total cases, deaths of 4,473. Texas, 2.94 million cases, and we've had 51,283 deaths. All of them too many. All of them too many. And if we do not adhere to the vaccination, which is being given free, all over the community, free, say it again, free, then we realize that we're not going to get where we want to be. In El Paso, the most impacted persons with COVID-19 are teenagers. That's why we're proud of Carrie Ann. We're very proud of her. And I'm glad that she stopped here with us. Her congresswoman, I'm going to claim her because she spoke so well. We want the message to go out. Parents, this is not a time to step back. It's not a time not to bring your child. If your child is of this age, you have to come with them. If they're 12 years old and up to 17 rather, you have to come with them. How are you out shopping and you don't know, with your mask off, who in the grocery store, if you're in one of those stores, is not vaccinated? Who's COVID-19 positive? Because as I said, people are not getting tested. If you are not vaccinated, you need to be tested to determine whether or not you are positive. So today we are here. We have had people coming in. We have Moderna and Pfizer. The children have to get Pfizer, and that's what we're advertising. But it is imperative to realize the variants we're not relieved of the variants. It's important to realize that those who are most hospitalized right now, most hospitals will tell you are younger, under 40, and teenagers. And it will also say to you that if we don't take advantage of this massive opportunity for vaccination, we'll never get mass immunization. And as we open our borders for travel, people will be going back and forth, and various variants are needed. African countries are calling me, begging for vaccines. How does it look when we are in our home and we're saying it's raining and we can't get here, or the sun is shining and we can't get here, or the beach is calling and we can't get here? And other countries are begging us for vaccines. Their children are in need, their elderly are in need, their families are in need, and we are not here. So I want to make sure that I let Carrie Ann go on to get vaccinated. Her mom has been so kind. And what school are you here?
I attend Westbury High School.
All right. And what grade?
I'm a 10th grader.
And is that what you're going into next?
Oh, no. I'm going to be a junior next year.
Oh, you got to talk about what you're going to be. All right. And you're going to be a vaccinated junior. Is that right?
Yes, ma'am.
She's going to be a vaccinated junior. We're so happy about that. And do you have any goals that you want to share with us?
In life.
What you want to do? Thinking about it yet?
I want to go to college. So
all right. Say that.
I want to go to college so I can be a lawyer.
Yay! From one lawyer to the other. All right. I'm proud of you. All right. Very good. So I want to make sure that we acknowledge, and we're going to have our principal, who has been so gracious, and we just want to acknowledge Jacqueline Thompson, Brenda Winters, the St. Joseph team that's here. Dr. Allen, I'm looking at. She was here earlier. Okay, Dr. Allen, we want to thank her very much. Our HISD nurse, Sherilyn Laws. Thank you to Deidre Morin, our nurse professor. MC, K-Dog has been doing a great job. Thank you to all the HISD police officers. Give them a very big hand. Our community leaders, Ms. Browning, thank you to our HCC students that are here and to our U of H students that are here. We thank you so very much for your presence here as well. And now it's my privilege to have our hardworking principal come forward, and thank you so very much for welcoming us to your campus. I've been here before, obviously, we'll be back, but we want to get vaccinated, and we thank you for having us come on our campus. This is the first time we've been at Cullen for the vaccination, but they were gracious enough to have us here for days during the testing, and we had a lot of people tested, so we're going to get a lot of people vaccinated. Madam Principal.
All right. Thank you. Thank you, Congresswoman Sheila Jackson Lee. I truly appreciate it. Again, I am the proud principal of Cullen Middle School, and I'm so excited about this opportunity. Congresswoman, I just want to thank you for your ongoing efforts. Like she said previously, she has been an anchor in this community before the pandemic, during the pandemic, and as of now as well. I want to urge all of the community again to please come out and get the vaccine. We know what the statistics are. She spoke of it earlier. The vaccine will truly help the immune system to fight off the infection. And most importantly, we need our students back in the building. Our students are wanting to be back in school face-to-face with their teachers. So please come out, 12 years and older. Parents, please bring them out if you need to get the vaccine as well. We'll be here until 5 o'clock. Also, I want to re-emphasize again, I want to thank Mr. Walker. It is an honor to have you here today. And Carrie Ann, who just went back in to get vaccinated, I am so proud of her and her efforts. Again, this is our first time with the COVID vaccine on our campus, so we are truly blessed that our community has the opportunity to participate in receiving this vaccine for free, as we indicated earlier, for free. I also want to say, yes, you can give them a round of applause again, free vaccinations. We have some great things going on at Cullen Middle School, and one of our initiatives is an IB candidacy school. We are an IB candidacy school, and we will be authorized in the fall. So please, can you give us a hand again for that? We're excited about that. Our students are excited about that, our staff, so we need our students back in the building so we can keep promoting their success, keep making sure that they have the best instruction possible, helping us to close the learning gap that they've experienced throughout this pandemic. So once again, I urge you to come out. We really need to make sure that we are all vaccinated so we can go back to normalcy. Thank you very much.
Thank you, Madam Principal. I'm excited about what's happening to you. I have Jakari over here. He got called in. I'm trying to get all my young people, he didn't ask to speak, but I want him to tell us what his name is, his age, and why he's here, and why he thinks it's important to get what he's going to do. Congresswoman Jackson Lee appreciates you. Okay, go ahead.
What I do is,
What's your name?
My name's Jakari.
How old are you?
13.
And why are you here?
To get the COVID shot.
And what do you think is that? Tell us why you think that's important. But you're glad you're here? And you're going to tell others you got the shot? We don't mind if they don't know why it's important, but we are glad that he's getting it. And we're glad his mother brought him, or his parent brought him. His mother brought him. We're happy about that. Do you play football, brother? Why don't you say that? Tell us what you play.
Football.
And what position?
Fullback.
Well, if you play football, you need a vaccination, don't you? Yes. All right. So we're glad you're here. Thank you, Jakari, for coming. And you'll be a role model for so many others. Thank you so very much. Give him a hand. Seventh grade? Is he at Cullen?
as addicts.
Addicts, all right, in the 7th grade, all right. Okay, let me have St. Joseph, please come up. We're so delighted. St. Joseph been our partner over the weeks, and we're going to be breaking through this vaccine hesitancy and keep working. Thank you so very much.
Absolutely.
St. Joseph.
Thank you. First, we want to say thank you to the Congresswoman. She is the busiest lady in town, running all around, making sure everyone has the opportunity to get vaccinated. So thank you so much. Thank you to HCC. They've been with us through all of this, helping us get people vaccinated. And every weekend they are out and about with the Congresswoman, making sure that we are making it available to you. So please don't wait. Get vaccinated. We are all over town, so find an event and get it done so we can get back to living.
Thank you so very much. Director, Professor Mooring, please come forward. Houston Community College. We have been really on a journey. Yes. I think we're in about our 8th vaccination site, maybe more. You would know. You're keeping account. I just do. I think there are more. And we want to thank you for working with us in the Houston Community Colleges. Thank you.
Thank you, Congresswoman, again for the opportunity. And I am especially glad to be here today. Guess why, Congresswoman?
Yes.
I am an alumni of Cullen. 40 plus years ago when it was Cullen Junior High. And it changed over to middle school. So I'm just really excited to be here in the community in which I was raised, to be able to vaccinate here. We have quite a few young individuals who have came through. We talk with them, and we're just excited to be here with you on this journey. We're very excited. And Mr. Walker, we were glad to vaccinate him as well. We do have the HISD nurses are here with us today. Okay, we have one here. They went in the back. We have a couple of our students as usual. But we will continue on this journey with you.
Thank you so very much. Thank you. I support HISD nurses, and so you come on up. I think a nurse in a school makes a difference, and I think Madam Principal will tell me that's true. All right, thank you very much.
I'm just so happy and elated.
Your name?
I'm Rachel O'Neill. Rachel was your staff assistant, my sister.
Okay.
Rachel O'Neill Taper. I'm happy to be here. I am a registered nurse. I volunteered to be here today to help vaccinate and observe everyone. And I think it's an honor to be here to vaccinate our students. And Mr. Walker, come one, come all, everyone come out and be vaccinated so we can get back to normality. Thank you so very much. Sheila Jackson Lee, Congresswoman. Thank you.
So let me see if there are any questions. Again, the emphasis that I want today is that we're going to have to break through vaccine hesitancy. We're going to have to recognize that we will not have a full opening of the country. We will not have people with confidence to be able to completely remove the masks and all other things. And we will not be able to protect Mr. Walker. Mr. Walker has grandchildren, and he wants to be out. I'm so happy he is here. I feel especially happy because Mr. Walker has found a place where he could come in, be treated with a vaccine, and go out, and his daughter could bring him at a convenient time. That's what we are looking to do, to be convenient for all of you and to make sure that we have the opportunity. It is important to be documented or undocumented. We don't ask any questions. We don't ask any questions of the children, of the parents. We want to make sure that everyone is vaccinated. That's what he represents. And again, let me be very clear, the variants are alive and well. COVID-19 is not going away. It moves from one country to the next. Other countries are crying out for vaccines. We have them. We have more than enough. They are coming from the federal government through the state and then to local providers. And we're working with St. Joseph's and other agencies. This morning, we were at the International Church, the Greenhouse International Church, with E.A. Deckard and UMMC on the north side. So that is our methodology. We're going to go and go and go until we can reach people and get them to understand that it will not be the right kind of summer, it will not be the right kind of school year if they are not vaccinated or they're not tested. I can't say enough. We will not open this country, period, if we do not get vaccinated. That is an admonition that we need to understand is very real. And we will not be able to completely free ourselves of the mask, because everybody will want to protect themselves, and they'll be wearing masks in different ways, because no one now can guarantee that they can go into a room and everybody is vaccinated. That makes a difference. Let's get over this hesitancy. Let's get right and do the right thing. Let's go out to vaccinate. Go out to vaccinate, because that's what we need to do. Mr. Walker, thank you so very much. I'll open it up for any questions, but thank you so very much. Did you want to say anything, Mr. Walker? Are you glad you got your vaccine?
Yeah.
How do you feel? You feel good?
Yeah, I feel good.
All right. He feels good. Any questions? All right.
Congresswoman, President Biden declared mask or vaccine. Be able to get vaccinated or wear a mask. How does it feel to reach that milestone between declaring that if you have your vaccine, you can take off the mask?
Well, that's what I think is the message that I'm saying today. You can't take off your mask. We can't be completely open until you have a vaccine. If you have a vaccine, you can take off your mask. If you don't, you need to wear your mask. And that is what we need to get the American people in our community to understand. If you want to take off your mask, and everyone takes off their mask, then they must be vaccinated. And I think that's what the president is saying. We can't have people who are not vaccinated without a mask. So you're either wearing a mask or vaccinated. For those of us who are extra cautious, we wear a mask because we don't know whether you're vaccinated. And people who are wearing masks feel the same way. But we will not get to mass immunization if the message is not getting vaccinated. I think that is our answer if we want to open America, open our travel, and as well be received by countries around the world. We realize that there are some countries that are not able to come into the United States because they have a very high risk of COVID-19. If we were through COVID-19, we wouldn't be looking at other countries saying they are having rising numbers. And who is going to be a hotspot next? What continent is going to be a hotspot next? What is going on in India, but what is going on in Afghanistan? What is going on in South and Central America? These are questions that have to be asked and answered, and only when the world is at a level of vaccination can we really say that COVID-19 would be behind us temporarily. But we don't know what next pandemic that may be a spinoff of COVID-19. I can't tell you how important it is to get vaccinated. Another question.
Yes, one more question, Congresswoman. So we know that the current vaccines have been proven, well, they're showing that they're resistant to the variant at this time. Early on in the original, when the pandemic started, we were looking over to China and saying, oh gosh, look at that pandemic happening over there, but we saw how quickly it came to the United States. How concerned are you about these variants and the 2 cases out of Dallas, even though we do have vaccines? How concerned are you about those variants showing their face in Texas and where it could potentially go from there?
That's my message, that COVID-19 is not behind us. And because COVID-19 is so unique in its ability to, I will use the word, to multiply, to move in a different direction of a different variant, then we can expect the fact that there will be COVID-19 variant that is something we've never seen before. Yes, the CDC and the NIH, the National Institutes of Health, say that the vaccines we have would be responsive to the new variants, but we don't know how the variants will impact individuals that are not vaccinated, or in terms of how sick they will become. Obviously, a different variant will respond differently. What kind of care will you have to have? You best not want to get that variant, and in order not to get it, it's a vaccine. Variants are going to continue, and it is very interesting that 2 teenagers in Dallas have the COVID-19 variant. And as I indicated, those who are in the hospital and most of the sick or the sickest are young people now, under 40, who have not been vaccinated. We have the ability to vaccinate 12-year-olds. Let's get them vaccinated. And all of you 20 and 30 and 40-year-olds, you need to come and get vaccinated. really need to come get vaccinated. And as well, if they are not vaccinated, don't forget COVID-19 testing. Do be kind to your family and friends. And I would encourage you to get tested or vaccinated before the Memorial Day weekend. Come on now. That's going to be, I think, a potential super spreader, because more people will be on airplanes traveling, more people will be visiting thinking that everything is well, and more people will be possibly taking off their masks without being vaccinated. And I would encourage you, make that be a action item, just like packing your suitcase, taking your toothbrush and toothpaste. Get vaccinated this week if you're taking off or going to be around a lot of people during the Memorial Day commemoration of our fallen soldiers. Thank you. All right. Thank you all very much. Thank you to the University of Houston, Ms. Martin, and all of you.